Legendary comedian Sinbad is recovering after suffering a stroke. His family didn't release a whole lot of information, only to say that they are faithful and optimistic that Sinbad will bring laughter to all of our hearts soon.
Now, Sinbad is 64 years old, probably best known for his HBO stand-up specials, his role on the sitcom A Different World, and a long list of voiceover work and movies. The news also put some light on other health problems in the world, while most of us are still focused on the pandemic. Clinical nurse Alice Benjamin joins us. She's back once again with us. Welcome back, Alice.
Thank you. Nice to be here.
Hey, Nurse Alice, how has the pandemic impacted other health issues such as stroke?
You know, we are so focused on COVID-19 and the prevention of that other things have taken backseat. And that's something that we don't want to happen, because when we look at stroke, some of the most common signs and symptoms of stroke include a facial droop. And so now that people are wearing masks to protect themselves during COVID, that's one of the things that's making it more challenging for us as healthcare professionals to identify that people are having strokes.
Nurse Alice, let's talk about that for a minute. I remember being at a friend's house one time. She said, "Oh my gosh, I think my dad's having a stroke." So what are the symptoms? How do you identify? And is there anything you can do right away as someone else dials 911?
Right. So a stroke is definitely a medical emergency. Time is tissue. Once you've identified the signs and symptoms or think someone's having a stroke, call 911. We'll worry about it later if it's not. But some of the things that you want to look for is looking at the person's face. Ask them to smile. Are they having some facial drooping? Ask them to stick their arms out. See if one of the arms is drooping or it drifts downwards. And then ask them to speak. So if you ask them to say a sentence and you notice that their speech is slurred, that also might be a sign. And then also any sudden onset numbness or headache or confusion or problem seeing, those could be signs that someone is having a stroke. If you see or suspect any of those, call 911 right away.
I like how you say call 911 and we'll worry about it later. So after a stroke, Nurse Alice, is it possible to regain all of your motor skills if they've been impacted?
Yeah, so that's an interesting question, and it differs based on the individual and what other health conditions you have. Once someone has a stroke, we like to see speedy recovery, but sometimes it can take up to 1 year for someone to fully recover any motor, speech, or cognitive deficits from a stroke. But that's why, Michael, early identification and early treatment is important, because if we can get you in sooner, there are medications and therapies and treatments that we could administer that can hopefully reverse and prevent further damage from your stroke. Once a stroke starts, it's evolving. So we want to stop it right away when all possible and get you on the road to recovery. But that requires you calling 911 and getting to the hospital right away.
Who should worry about this more? Men, women? What age do you start looking for strokes?
Yes. So the most common stroke, which is an ischemic stroke that we talk about a lot, the risk factors for that are more so in men, people who are over the age of 65, people of color, people who are overweight or obese, and people who smoke and who have a blood disorder. So those are, and high cholesterol. So those are some of the common risk factors that will increase the risk of you having a stroke. But there are other things that come into play. So we're talking about COVID. If someone gets a COVID-19 infection, that triggers an inflammatory response. So there's actually research, Carolyn, that shows that people who have been exposed to COVID have higher risks of stroke. And we're seeing that in some of the cases as they're coming into the hospital.
All right, Nurse Alice, thank you for shedding some light on that.
All right. Nurse Alice, thank you for that.